My name is Micah Drummond. I'm a professor in physical therapy and the molecular medicine program at the University of Utah. I've been quite interested in understanding how aged muscle responds to stressors, both on a functional level as well as a metabolic component. And these stressors come in all shapes and sizes. Since I'm in a physical therapy program, my interest is in rehabilitation. The ability of aged individuals, in particular skeletal muscle, how it rebounds back from injury or illness or surgery. And so we've been interested in mechanisms of how aged muscle responds to those stressors, as well as developing interventions and therapeutics, how we can make aged muscle respond better to stressors and enhance rehabilitation outcomes. Muscle is much more than a tissue that just helps you to move from point A to point B. Muscle is a reservoir to store molecules that we use for energy. And so by having more muscle, we'll have more energy levels. More so than that, muscle helps us maintain blood sugar levels, particularly when we eat a meal. Muscle is very important for expending energy, both at rest and when we move. It's one of the most metabolically active tissues that we have in our body. So more muscle means more energy expenditure. Muscle releases what are called myokines, which are molecules that affect other tissues in our body, such as our brain. Now, exercise is well known to improve memory and mood and learning. And so by maintaining an active lifestyle, that's going to affect your muscles and other tissues in your body. And likewise, it's going to affect, in a good way, your brain's ability to remember things, to learn things, and ultimately be in a better mood. I am definitely in a better mood after I exercise, or when I'm in a bad mood, I exercise and my mood changes. When I think of muscle aging, I think of sarcopenia, for example. Sarcopenia is the gradual loss of muscle and function as we get older. So I feel like scientists are getting a better grasp of what are the components that contribute to that loss in function as we age. Muscle aging is a normal progression of life. However, certain factors can accelerate muscle aging. These include being physically inactive, as well as muscle disuse periods in the form of injury or illness, or hospitalization, or surgery. These are all factors that accelerate muscle aging. As we age, we lose our ability to properly recover from these events that's impacted by aging. So if we can avoid being physically inactive, and if we can avoid these disuse periods, we could definitely offset age-related diseases and conditions. As we get older, our endurance capacity lowers, just like our strength does as well. Well, if you follow individuals who maintain high levels of endurance throughout their lifespan, these are referred to as master athletes. So they continue to exercise at a high capacity. You'll find that over time, that their endurance capacity still decreases over time. However, in those individuals that don't maintain their endurance, and you can see that drop-off occurs much faster. And so by maintaining your exercise capacity, or by continuing to exercise, you could blunt some of the loss in endurance capacity. And similarly, it could be said for the same thing with maintaining your muscle mass, like in resistance exercise. It's a much slower drop-off, though age still gets us, but just at a much slower rate. And it's not too late to exercise. You may be in a circumstance where you've never exercised before, and the point I want to get across is that you can still reap the benefits of exercise. By participating in exercise, you get stronger, it's going to make you feel better, it's going to give you more energy levels, and it's also going to reduce the risks associated with injuries too. I'd be all for living to 100 years old if the new 100 is similar biologically to a 60-year-old. And I don't think we're very far from that aspect. If we could just target or limit some of these age-related diseases and burdens, I think people are going to live longer and healthier than we currently are now. So the new 100 may look like someone who is 60 years old. The reason I'd want to live to 100 years old is to definitely see the next generations of my family to the third, fourth, fifth level of generation. It'd be cool to be a great-grandparent or a great-great-grandparent, to be able to see my kids' kids' kids. I think that'd be really, really neat to have one of those really big family photos where you're the really old one and you just see this long line of kids amongst kids that came from kids. They're all part of your family line. I think that'd be really, really cool.